Fine. So with the permission of our chairman, sir, we would like to start with the program. Chairman, sir, and learned speaker of today, Dr. Nilanjana Ghosh, madam, and dear participants, on behalf of chairman, sir, and I'm on my own person, it is a privilege for me to welcome you all this morning in this 12th lecture of monthly scientific interactive series being organized by the board. I am very pleased to inform you that since it is the 12th lecture, it signifies that we have, it is almost 1 year we have completed with this endeavor. So I would like to request for a big hand for the board. The main objective of this program is to disseminate the scientific information, the workings, and the latest developments in the field of environmental science, and of course, for the benefit of people among masses, the scientific community, the research scholars, the students, and all the stakeholders who are working in the field of this environmental conservation. So with this objective, this board had started this series, and not only this series, rather we organize different special lectures in addition to this on various occasions, sometimes in-house or sometimes by the learned scientists and workers in the field. So today we have with us Dr. Nilanjana Ghosh, who is a doctor by profession, a DNB, and working with Guwahati AIMS. So she will be talking with on the topic of climate change and its effects on health and remedies. We all know that the climate change phenomena is here. के ऊपर different schools थे, पहले different thoughts थे, but now it is completely established that the phenomena is here and we are experiencing the effect on our environment as well as on human health. So, or as reported in many of the studies, the effect of climate change is going to impact mostly the people who are little poor, the ladies and small children. They are the most susceptible to this effects of climate change, and their health is really prone to it. This board is also conducting some studies on climate GHG emission inventory, climate change impacts and all, and to suggest the state government pathway, a roadmap for making the state in the line of the target of the country, carbon neutral by 2070. So we are also studying the impacts, and it is a great opportunity that today we have a doctor who is studying the impact directly on human health, and of course the remedial measures to be taken. So I welcome Madam.
Thank you, sir.
To this session, and I would like to request my colleague Sri Arun Kumarji to introduce the learned speaker of today. Little details about her for the benefit of our participants. Sri Arun, please.
Thank you, Dr. Mishra. Good morning to all, and respected Chairman Sir and other dignitaries present in the session and our colleagues. I again welcome to Dr. Nilanjana Ghosh, this scientific interaction series being conducted by this board. She will enlighten us on the effect of climate change on our health and its remedies. Now, you all are eager to know about Dr. Nilanjana Ghosh. She has awarded with degrees of MBBS, MD, and DNB, MNAMS, DHM, PGDEPI, PPHN, and presently she is working as Assistant Professor, Department of Community and Family Medicine, AIMS Guwahati, having professional experience of 20 years with 14 years in public health and maintains IELTS a score of 8.5. She has great skills in clinical with a special course in diabetes, immunization and emergency services, health communication, epidemiologist, statistician, medical teacher and researcher, public health neutralization, and associated with the International Public Health Management Development Program. She has also worked with COVID-19 RRT member and screening clinic in charge and vaccination co-nodal officer NBMCH Darjeeling district and IDSP in charge Darjeeling district, West Bengal. She is in the National Editorial Board member of IJPH, that is Indian Journal of Public Health of IPHA. Central team member of RIMs for HIV Sentinel Surveillance. Editor and author of book publication on hospital management and women welfare empowerment. She has authored books on OSCE, DNV family medicines, and reviewer of community medicine practical books. Affiliated with Indian Psychoanalytical Society for Counseling, Kolkata, organizing secretary of a pan-India sensitization program on welfare, women empowerment conducted from AIMS Guwahati. She has also conducted pre-conference session in IAPSM Young Leads National Conclave in AIMS Bhubaneswar in 2022 and was awarded a significant contribution award. She is also panelist of Mental Health Awareness IPHA State Conference in June 2022 and in National IAPSM World Mental Health Day 2022. Conceptualization and presented Pan-India Mental Health Helpline before stakeholders on behalf of IAPSM in 2022. She was judge of oral paper presentation in EFICON in AIMS Patna 2022. Invited speaker and panelist on various forums of public health, the Union, ARDSI, Sydney, Voice of Environment, Dementia, AFPI, APCRI, and IAPSM. She has also authored 20 publications as first author in various indexed journals with and invited articles. She is reviewer of PubMed indexed journal like IJPH, WHO, ACAJPH, PLOS Global. Moderator in session of family medicine webinars and invited speaker in National AFPI conference. OPI and coordinator of 4 states of an ICMR approved project on flood processing and distribution. co-PI of an ICMR approved project on INDEN study, working at grassroots for children and women welfare with non-governmental organizations and for preventive uh, geriatric care. Life Member Epidemiology Foundation of India, IPHA, IAPMS, AFPI, attached with philanthropic organization like Child in Need Institute, received Professor M.M. Ganguly Award for Young Scientists in IAPSM, a state conference for presenting a study titled Performance and Satisfaction of Auxiliary Nurse Midwife in Darjeeling District, West Bengal, India in 2014, while she was doing postgraduate research. Yes. Thank you.
Thank you. Thank you.
Thank you so much, sir, for the very humble person, and that really sounded so nice. But above and far beyond, we all need to focus on where we are, where we live, our house, and just beyond. And that is where this today's topic comes into being. It's a very pertinent topic, and actually health remedies and health diseases, illnesses are just a part of it. But again, we need to prevent environmental pollution or environmental damage, because it's a moral responsibility. We all stay in this mother earth, and it is not for our use that we keep on using whatever we have and then we just throw the garbage to this mother earth and go away. The next generations will suffer. So this cannot be, and just keeping your house clean will not work. But the main thing, this is prelude. Let me start today's topic. Climate is changing and so we are adjusting. Or is it that we are changing and the climate is adjusting? Till it can no more adjust, and tsunamis, earthquakes, landslides, all these things come into being. Finally, but we humans still don't bother till we get into these effects which affect our health, physical health, mental health, whatever. Then came COVID. Just after a disastrous picture of Amazons were burning, we saw those pictures. We were just seeing how rampantly trees were being cut, deforestations were happening. And then we had this picture of Amazons. I still remember, it just gave me chills. The dense Amazon, which is the oxygen of the entire world, it was burning. People were even, it was like those trees were being cut. And then suddenly COVID came into being. Not going into any reasons why, where, what happened, but COVID literally pushed us back to our houses. The nature healed drastically and dramatically. The animals went around. There were a lot of pictures that people are locked as if we were getting punishment for being so wild on the environment. Maybe that is one take we can take. And COVID just pushed us back to our homes. And we realized how important it is to stay healthy and hearty. How important it is to stay in the house, and how important it is to take responsibility of each one's health. If I don't wear a mask, it is not only me who is getting affected, the next person to me can also get affected. So we wear a mask for us, for the other person also. Similarly, COVID brought us a lot of depression. A lot of things went into being. Mental health was severely affected. Depression, dementia, as sir was saying, people who were already on the mental health borderline cases, they sank more. Healthcare was not available very easily. And so these kind of features also came up with COVID, which again, since all these things happened, social distancing, physical distancing, etc., we realized how important it is to have environment as before. But again, why are we worried? We are just worried because if we now don't worry, our next generations won't have twinkle, twinkle, little stars to sing. They'll just see smoggy skies. They will have all the water dry from the taps. They will have burning deserts. They will have seas swelling. They will have glaciers melting. And that is where the onus lies. Our nests can only be protected only if we protect the Mother Earth from where we belong. With this, I will move out to what is environment. And my first slide, please. Our environment is not only external. The slides may please be shared, sir. The slides may please be shared, sir. And with this, we come down to what is environment. Well, climate change and its effects on health and remedies. The first slide, please. With this brief background, we will turn out why is it important to have, and what do we mean by environment? Environment is not only external, it is internal also. There's a difference. External environment means which surrounds us externally. Internal environment means which is inside our home. and which goes on, which is our immediate environment which surrounds us, and we are accountable and responsible for both. A climate which was, we hear when I was in Darjeeling for long, and we hear long back we did not need fans, long back the environment, it was so environmental friendly, there was no pollution, the stars were visible, etc., etc. But now everything has changed, but now we are also changed, and the thing is we have only changed it. It is the environment would have been, there are still some places, a very famous place called Molin Long is still there, where we still see star-studded sky. It is the cleanest village in Asia. But my question is, why can only be one village point the cleanest village in Asia? The entire, it is not only the topography, it is not only the terrain. Many villages are there in the same altitude. We even can maintain, cleanliness is something, it is next to godliness, and we should maintain it properly. But we have kept on bothering things beyond our means, and we have kept on using things which we should not have. For example, when we say that the taps dry, it is not only about water. There was few studies which show that in Johannesburg and South Africa, they are actually running dry, and water capsules are being found. So now water, we have to buy water. Even we in India have to buy water now at many point of time. But then in few places, water even after buying is not available. There are places in India where the soil is so dry that you cannot even dig water. You have to dig into large amounts to get the water. Same applies for the plastic use on the sea. Same applies for the amount of air pollution we create all over. Being a member of Society for Indoor Air Environment, SIE, with my mentor. So he also, he gave me this first, sir only told me, Dr. Arun Sharma sir, he told me that how our small change, our interventions can help the environmental being more clean. We should be environmental friendly. That is the main thing. But reasons beyond, a lot of things happen. We have vehicles, automobiles, these are the necessary evils. We need them. Air conditioners, vehicles, then mobiles, automobiles, engines, industrialization has come up in a big way. And with it comes the effect and the side effect. The side effect being a lot of emissions, which are not environmental friendly. Rampantly, we are having the smoke emissions, which we see even on the roads, trucks emitting smoke openly, vehemently, despite the pollution laws being in place, and things are just not in control, and we just do nothing about it. So this is how the environment gets polluted on a daily basis. On larger basis, well, we need industries, but then we need to have a check. We need to have a balance. CFC, chlorofluorocarbons and other emissions, they pollute the environment. We have some smog particles coming up, which have some particular diameters, and when they enter the respiratory system, they can cause huge damage. With all this in mind, the world shook up finally, and Kyoto Protocol came into place in Japan. But protocols kept on being made, and the environmental pollution also kept on happening hand in hand. So Kyoto Protocol says that each country is liable to the amount of emissions they do, and also liable to cleaning it up. But then everything is set in pen and paper, and we still loom about large with talking about pollution till today. My next slide, please, which focuses on the global scenario. Well, developed countries and developing countries, there is always a difference. It is not only about economy, it is also about how we handle this industrialization. We always are of the opinion that developed countries, since they handle the economy more in their hand, the industrialization has brought about a rampant change in their scenarios. They use all the best modernization gadgets, and the brunt is borne by the developing countries. Many studies have shown that there are a lot of examples and proofs to prove that the developing countries are bearing costs of the developed nations modernization, so-called urbanization and modernization. There are few countries which are very safely located in islands near the seas, but they still get saved. But largely India is one of the worst sufferers. Metropolitans again in India are now they're just burning like hell. Every other day we come up with a term called AQI, Air Quality Index, and we see that AQI is not very nice in few cities. Far from being nice, it is alarming. It is on the red zone, and which really causes us alarm. Children are sent back from school to the homes. They are kept when the pollution levels are very high. This is something unimaginable. But we have to go out to work, and children, we cannot allow them outside, even if for short durations. This is enough a warning bell which should ring us. Air quality index, again, in many countries, it is beyond the level. Beijing, for example, in China, it is a very bad air quality index. In India, Calcutta, Delhi, all the metropolitans top the list of being the worst affected. And the kids staying there, they are also worst affected. Many kind of respiratory issues and other illnesses come among them, which we don't coin. We go to physicians, but maybe what needs to be done is not even at physician's hand completely also. If the environment doesn't change, where you breathe, the air you cannot change it, what good will you do with medicines? Plastics, again, one big thing, where water pollution with sewage and inadvertent oil spills. We saw a lot of wars happening even few years back. So we have oil spills over these seas. Plastics we throw, the plastics, they muffle the fishes, and the plastics create a lot of waste, which is again not degradable. We have a lot of laws, lot of things come up to being awareness generations in its place, but plastics are something unnecessary evil. We cannot do away with it. Even now I'm holding one mobile in one plastic cover. So that is how plastic is into our lives, and still we remove it totally. Till we have stringent laws, in fact, to the extent of being punishable, this menace is not going to stop. Widespread deforestation is another big thing. Again, myself quoting in Darjeeling district, we said that we had these huge forests, there's Latagori forest and all, and then a lot of forest in Assam also now we are seeing. But deforestations are massive. People come, they cut down the trees, and they just go away, walk away. So, and in name of forestation, urbanization, flats are being built. We only book these flats, but then again we only complain of global warming. So it is not how it makes. We see of Chipko Andalan, we have heard of some authors and some, there was one person who cut the trees and he built a hand on the tree bark in the shape of a hand that stopped cutting me. We go to things like, a lot of things are coming up. We preserve old monuments, so we should preserve old trees. Yeah, we should not cut trees only. In fact, we should plant more trees. But then again, deforestation is something which is causing a lot of global warming, and that's one of the major reasons why the entire topography and the economy, everything is changing for good, for bad, but environment is suffering. The more we go into this kind of urbanizations, modernizations, more it is environmental suffers the most. Land pollutions, again, lot of land pollution, water pollution, air pollution, everywhere, everything is just polluted, and we just need to come out of it. The next slide of mine, the next slide, please, talks about the health hazards, today's topic. Well, health hazards are a big topic. Hazard means something which we face. Hazards are something which we inadvertently create. The word, I have a strict problem with this word hazard because it is man-made. Mostly it is man-made. Hazards are something which happen to us. For example, occupational hazards. It happens to you are a doctor, we are a doctor, we go to a patient, we put a needle and that needle prick happens to us. That is an occupational hazard. A person who is a driver, he can have an accident, that is his occupational hazard, but he has not invited it. But health hazard, though the term we use it, but is something, environmental dysfunctionality is something we have invited. So the better term will be the health impacts, I think. Deliberately I put the term, but impacts will be a better term because something where we can always intervene and bring about a change. Exposed due to higher level of pollutants, occupational hazards, again, accidental exposures, atomic blasts, bioterrorism. Few words I've written, I'll explain them one by one. When we work in some industries where their air pollutions are very high, when we work in some particular particular industries are there where people are more exposed to pneumoconiosis, bagasosis, vicinosis. So these are few occupational hazards which can affect you. Then again, but the overall generalized, the AQI levels being very high, smoke emissions being very high, these cause exposures even to small kids. So cement factory near your house, this will definitely going to affect your respiratory system, if not other systems. Some accidental exposures occur, like Bhopal gas tragedy happened. So these are few areas where we could not help, but then these were, like massacres, and millions of people died just with the small leaks and all. So we should be, again, so we should be careful of what we are making, because after all, we are all humans, and human errors can cause destruction on such a big level. These things we need to be very careful. Chernobyl tragedy in Russia, the same thing. Again, bioterrorism, man-made, the worst part of things. We have BSL labs, biosafety limit labs, BSL1, BSL2, BSL3, BSL4, where a lot of man-made or some microorganisms are there, and pollutants are there, and these also, if exposed, those who handle them, or if some inadvertent exposure occurs, they can cause widespread damage. Moving on to exactly how it affects. Well, this is where we are interested. This is what human beings are only interested about, because now we are seeing that we are suffering. Till the world was suffering, we think we'll live for 50, 60, 70 years and go away. Then what, how does it matter? But now we are seeing it is not happening like that. We are in this 50, 60, 70 years we live, we are suffering hugely. First and foremost, respiratory system. Yes, there are some particulate matters, lot of sizes, microns, 2.5 micron. If it is less than that, it enters the respiratory system and causes a lot of damage. So asthma, chronic bronchitis, emphysema, irregular bronchitis, people in Delhi, kids in Delhi are getting very much affected. Every day we find cases with children having respiratory COPD. So all this, those who have COPD gets aggravated, allergic rhinitis, this is a regular finding. In addition to this, we find respiratory diseases which were already there aggravated. We find respiratory new diseases coming up in children. And again, we advise now everybody to wear mask, COVID or no COVID. So this is a situation. So if you wear a mask, at least a physical, some amount of protection you can get. But is this a world we create for ourselves? Apart from respiratory, many studies have shown cardiovascular system is hugely affected with pollution. Cardiovascular system is, we have even heart attacks have been reported. Heart attack is a very layman term. Strokes, cerebrovascular accidents, lot of other arrhythmias, everything comes up with pollution has also been indicated, and many more studies are going into this. Researchers are finding out new studies where other systems apart from the respiratory system are affected due to air pollution mostly. Gastrointestinal and poisonings, these are again very common. Skin diseases. Dermatologists now find a lot of cases every day. In our practice, we find cases with skin diseases, skin irritations, allergies, eczemas, lot of skin conditions which were unheard of earlier, come up with allergic dermatitis, contact dermatitis, topography tests, then you go for allergic testing, and then you find again pollution is again a big reason of it. Your skin is hypersensitive. You say the skin is hypersensitive, but I don't know if the skin is hypersensitive, IgE cells become more active, but again these allergens, they cause a lot of issues. In Delhi, there's this locust burning happens, and then the entire the sky becomes dark. So all these things have not only affected the respiratory and the cardiovascular system, also the skin also is affected very, very severely. Again, radiation sickness and injury, something which happens, this is an occupational hazard mostly, but if exposed to some Bhopal gas tragedy or Chernobyl tragedy or some small leaks, then again these can also cause a lot of problems. Well, coming to our main topic, mental health. Now, this is again another area of concern. We never know. Mental health in India is strongly and hugely neglected, an area I work on. And strikingly, we have seen that now mental health disorders have a huge implication with air pollution. Air pollution indicators are area where air pollution indicators are not going nice. The mental health is strongly affected. It leads to a lot of issues, immediate tantrums, the changes in mood, bipolar disorders, depression, lot of things come into being. You cannot coin a person. Mental health is again treatable. So once it is not that once I am depressed, I'll stay depressed for the rest of my life. It's not like that. I can again come back, but these transient changes are happening more, and pollution is definitely implicated. Studies have gone into it, and recently also in connection with IIT, this Guwahati, we from IIMS Guwahati, we are conducting a study on the same. And this is one area we need to be very careful, because we never know where the air we breathe is so polluted, the water we drink, the rivers and etc. If they are so polluted badly, mental health is going to be affected. And only medicines will not help. Death again can happen, yeah. So, but the health hazards, especially the respiratory system, cardiovascular system, skin diseases, and mental health are the areas of major concern for us. Not only us, adults, but also the kids. All age groups, geriatric population, they're also affected a lot. So it affects all the age groups, mostly the kids and the geriatric population, and also those who are going outside. This is all we talk about outdoor air pollution. There's another term called indoor air pollution. Women who cook in the house, those inside, those who don't have proper ventilation, those who don't have even an LPG at home. Rural India is largely like that. All the windows, doors closed. They are affected with indoor air pollution. IAP is again another area of concern, largely neglected. And another study just has happened, where we see that the footfalls in the house or a footfall in an OPD or how many times movements in a house even again affect the IAP. Indoor air pollution is dependent on that also. So we need to have proper ventilation. We need to have proper house spacing. We need to have proper, no overcrowding in the house, because these also have been seen, and especially cooking in proper clean environment where where the smoke outlets are there. Otherwise, indoor air pollution is something we have grossly neglected, but it is causing a huge amount of damage. In fact, more than outdoor air pollution. So it is not only that the men folk who go out to work are exposed. Women folk who stay in the house cooking all the time in closed, ill ventilated, overcrowded homes, they're also equally affected. So this is another area which we need to work on. Air pollution can be both outdoor and indoor. Moving on to my next slide. Well, remedies. Remedies are in our hand. A situation comes in our life when we don't know what to do. But this is not a situation like that. It is not a tsunami that has occurred. It is something man-made. So, and operationally feasible, small, customized interventions which can bring about a sea change in our being is the need of the hour. Prevention is better than cure, we all know. But again, how to do and what to do. Here we need to look into our surroundings and see what we are doing. Is it really necessary? Whatever we are buying, one person, nowadays a family has 4 cars. 4 people go by 4 different cars. Is it really necessary? Some small user-friendly interventions can always bring about a sea change. Always law enforcements will not work. Or, the fear of law, fear of what others are saying, if still it comes from within, it will not work. We overcame COVID because we knew we wore masks ourselves. We knew if we wear a mask, it will prevent us and the person next door also. Similarly, if we take small steps on ourselves, then only we can prevent air pollution. So how to prevent? First is, if you have any underlying respiratory health or any health disorder, first you get a baseline assessment done, and then pre-placement examinations for industry should be done. When we go to work somewhere, we should have some pre-placement examinations and find out if we are prone to any particular kind of disease. If we are prone to any particular kind of disease, then we should avoid that particular kind of occupation, because there's always a risk of occupational hazard. Next to it, what next can we do? Just next to it, we can use curtail on the immediate needs which cause pollution in the house. Third, we should take care there is no indoor air pollution going on in the house as well. The house should be well ventilated and not crowded. To stop the ongoing well, a lot of protocols came into being. International collaborations were there. Strong legal implications and violence also happened. Chipko Andolan is a very famous Andolan. No technology, nothing. People just got stuck with the trees because they stopped them from cutting. So some things can be done like that also. But again, it needs a lot of onus from our sides. Awareness generation at school, a big thing. I always say charity begins at home. So awareness generation at schools, at colleges, such kind of programs which are being organized, a continuous quality monitoring and a continuous, with multiple stakeholders. This will only be possible if we all take the onus. Without political will and the funding, this is again not very difficult to do, but this is the only intervention which can bring about a massive change. Nowadays, we plant trees everywhere. We have World Environment Day. We celebrate World Environment Day, and these are small things which we know that how to save the earth. Children draw small pictures, save the world, save the earth, and that is how the awareness comes. Awards and aids to those who plant trees and who stop the cuts are also should be given. These are positive reinforcements which will help us take these steps in a far better way. But then again, moving on to the next slide, which is again about remedies. We already generate few wastes, but then what to do with what we already have? What we already have, well, few hospitals have come up with a lot of policies now. Stringent policies have come up on biomedical waste management. We have few bags, protocols, color codes, what to do, what color of plastics to be used, and what to be thrown where. It's very clear cut and demarcated. But then again, the main thing which stays there is segregation at source. Even at home, we have 2 dustbins. One is outside for papers, one is inside for kitchen. So similarly, in a hospital, when you go for suppose we go for a channel. So when we have a pin, we put the patient, in the needles, the syringes, the blood soiled cotton, they go into one place. The plastics, they go into some other place. And then the other accessories, they go into a black bag. So if we can segregate at source, that is the only way we can, stop the waste production causing more harms, more hazards, and also recycling that. So now this new word comes recycle. First is reduce the waste, reuse the waste, and recycle the waste. We still remember when we were kids, a TV program used to come, best out of waste. We didn't realize the meaning, but now I realize the best out of waste is something we should use something which is recyclable, which is biodegradable. So first to reduce the amount of waste we need to reduce. We cannot keep on generating huge amount of waste, and which is inevitable. The hospital wastes, they are segregated at source, put into demarcated bags, taken up by organizations. In Kolkata, it is Embranki. They take those organizations, and then they process the waste, and then they again recycle, which can be recycled. So reduce the waste, reuse the waste by proper methods, the proper autoclaves, and a lot of places how to reuse the waste. We have autoclaves, we have big factories, incinerators, and this is how you reuse the waste and recycle, which can be recycled. Small things even at home. Lot of things have come out DIY, do it yourself. So we can recycle the waste by do it yourself methods also. And of course, everywhere use color coded bins for waste disposal. The last slide, but not the least, we go to the remedies which we have formulated for air pollution, water pollution, land pollution. Specifically for air pollution, well, we have dust catchers, we have industries have put it up, we have AQI indexes, we don't allow, we have stringent laws. But apart from that, pollution laws in place, apart from it, we need to be careful. You use less automobiles. First is that whatever we are using should be environmental friendly. Second, same for water pollution, we should avoid plastics use. We should avoid the water being polluted by inadvertent use of it. Everything is not just for use of us. Land pollution with arsenic, a lot of minerals they go. We have arsenicosis and a lot of things. We use fertilizers, we use pesticides, and then those pesticides we take up in the plants, we eat them. So it's just a vicious cycle we are creating. And the worst part of it is we have created it. Best part is we can still prevent it. So prevention is cure, and we should do our level best to prevent it. Generating funds, promoting research on it, more political will, and more such symposiums and programs are definitely the need of the hour. Multi-stakeholder initiative, not only you and I can make a difference, everybody needs to hold hand in this and create a big difference to it. This is how we can get away with it. Otherwise, this air pollution will really, water pollution, land pollution, in one word, environmental pollution will really take away our mother earth from us. So, but then again, we have the next slide, please. The earth is a gift. We should preserve it for our precious. Don't let your children perish for the want of basics. Food, water, air, a clean air to breathe is their right, not a privilege. And it is in our hands. With this, I move to my last slide, which is the last slide. We have another. I have another slide with this. Just another slide after this. Well, this was a topic we initially thought of. Impending doom is a panic state. Yes, it is. But again, it is in our in our hands. It is not something which suddenly, it's not an asteroid striking to you. It is not a tsunami which happens, which is out of control. So anything which is in your control, we can always, make some amends on it. The take may be different, and we have to move huge distances. We have to change our lifestyles. We have to take new steps. But omnia signs are already present. The glaciers are melting. Climate changing is affecting mental health. It's affecting functioning. The generation next will have black smoky skies and dried rivers and barren lands and hot summers with freezing winters. No twinkling stars in the sky. It's only smog. No Machli Jal Ki Rani poems. It's all dead. And no Thandi Hawa. It's all loo or chills. So if we want to prevent it, it is a situation of impending doom, but the best part of it, it is preventable. With this, I come to end of my presentation. Let's join hands to stop polluting it more and clean environment. Thank you for your encouragement. Thank you, sir. And thank you, Dipankar Shah, sir, for your support always.
Thank you, madam, for the nice. We are privileged to have you this morning here. Now the floor open. Before we discussion, I would like to request our chairman, sir, for his remarks, and if he has throw some more light on that topic.
Thank you, Dr. Nilanjana, for this inspiring presentation.
Thank you, sir.
Yeah. In fact, we are all scientists here, and we are more stressed about the physical aspect of the pollution. for the first time, we are exposed to the human health angle about the effect of the pollution and the remedials. One point I would like to ask you, that is about internal environment. How when we the internal environment in our house, what we should
Yeah.
do? So,
Sir, actually, the first is the ventilation, overcrowding. These things should not be there. We should be careful. The place where we are cooking, the cooking smoke outlet should be in place. And this is mainly to avoid indoor air pollution. But then again, the internal environment in our house, we should avoid using ACs as much as possible. We should have, the as much as the as much as windows can be open, it is always good. And then again, we can use some environmental friendly plants can be there, aloe vera. We can put some plants in the house. They change the environment of the house. So some oxygen generating plants we can have in the house.
now we have several instruments that can the air purifier type of things.
Yes.
So, do you find them effective?
Yes, sir. Some instruments are there. They are effective. They help in monitoring. Most of all, they help in monitoring. But then again, it is debatable, sir. I'm not very aware, but I don't know. We have not used it still.
Because there are some HEPA filters in the market. So, sir is probably interested.
Yeah.
They,
Yeah.
It is available for indoor
They
use.
will not cause damage for sure. They are not harmful. How beneficial we don't know, but they are not harmful. That's for sure.
Exactly. Actually, Niranjana, you were there. When I was in CPCB, I was given the task to evaluate the performance of these things. And this your statement, I only put it. It is not going to harm you, and it is not going to benefit you. That is the output. But it is a business.
Yes.
The business is on in the name of indoor air cleaning purposes. So that
Yes.
was the conclusion by the secretary. By the secretary government those days. So,
Yes, sir.
I know your mentor also, fortunately, Dr.
Yes, sir.
Morning only, I told her, spoke to him, please come forward for an opening remarks. He told I may be a class, but definitely I'm coming to you.
Okay, sir.
It was a wonderful lecture, sir.
Anybody?
Or
Another remark, just I wanted to the best teacher, they don't depend on the PowerPoint because the PowerPoint only gives you only 25 to 30%.
Yes, sir.
Board can give you blackboard and chalk.
Yes, sir.
Practice. It can give
Absolutely.
professional support up to 70%. No,
Yes.
it is 100% foolproof.
Yes, sir.
And talking to each other, matching the
Yes.
frequency, that can give you up to 50%.
Yes. Which is interactive. More interactive is good.
50%. And PowerPoint, it gives only 30% to information, maximum.
Absolutely.
I am happy
PowerPoint.
that you have not used much slides. I'm really happy. And that is the thing I was just remembering.
Thank you, sir.
In fact, PowerPoint just give you a direction.
Yeah.
कि आप एक sequence में चलेंगे.
Sequence maintain करते हैं.
Otherwise, he said, और हम लोग भी बात करते हैं in our teaching fraternity. It is
Yes, sir.
chalk and talk. So
Yes,
you
talk is the best.
talk
That is
is
true.
best, and connecting with the audience, connecting with the
Yes.
students. So that is
Yes.
still works even today.
Absolutely, sir.
So other participants you have, उसमें भी देख लो chat box. Any query?
Another just recently I was going through a newspaper article there they are talking about the young generation. Depressed. They are really suffering depression after the COVID. What is your opinion? Any scientific study? All these things, sir?
Yes, sir. Actually, maybe post-COVID, the young generation is nowadays, sir, they are so used to getting whatever they want. So they don't, the resilience, I think, is very less. Like if the situation is there, it will go away. Again, things will come back. But that came from our time. And now it's mostly 1 or 2 kids. So they don't know also. This team spirit is not there. So whatever they want, whatever, everything is at hand. So any small rejections also they cannot take. I think that is a very important part. And after COVID with pollutions, maybe mental health is also getting affected. There's a sea change, sir. Like we, from our generation to this generation, the kids, they are changing drastically. So their needs, their changes, their resiliences are very, very different from us. Resilience is the only factor, I think, sir. I mean, they're very, we should build, some things are not beyond this topic, but I think we should build more on life skills in every class than, teaching them code things. Life skills are grossly lacking in nowadays. Even respecting seniors, to talking to juniors, to interacting with colleagues. The entire life skill we knew is very different from what it is now. So maybe that, and that creates, so small rejections also, they take it very on their heart. And so maybe, so that is also maybe affecting.
Madam, one problem we face, as you have also said, and we all know that the poor air quality or the higher level of AQI impacts our respiratory system. It leads to COPD. And so how to relate the COPD with the pollution load of the area? Because suppose number of patients are coming in a community. So what are the, how can we conclude that, look, this situation to the bad air? So just to how.
Yes, sir. There are many statistical tests to do it, but initially we should, before starting a study, we need to have a baseline. Like what is the existing situation? What is the current situation? Maybe that person is having COPD, or that person doesn't have COPD. Then we have that exposure factor. And after that, we do a post test, and then we see that this, because the COPD may have aggravated because of this suddenly increased in polluting environment. Or this, maybe the COPD has come up because of this particular, it was not there earlier, has come up now, or it was there later, and then now it has aggravated. So there has to be a pre-test, post-test kind of a thing with the exposure factor in between. Lot of statistical tests are there which prove it.
That is there because we regularly face this problem, because the number, we get the number of patients in a hospital, outdoor patients suffering from COPD and other related diseases. But how to correlate it? So
it is increased or not in the, it is increased or not in the recent past, and was there any exposure factor, or has it aggravated, something like that.
So we cannot be sure whether this disease is caused by the pollutants or it is by.
Yes, sir, we can be. Then we do go for statistical tests, and then we keep on eliminating the other factors. We take a lot of data, huge data is required for that. But then we analyze all the data together. Then we see which is significant, and then we keep on excluding one. Just say pollution, this is one factor. It can be cigarette smoking, another factor. It can be some other factor. So we keep on excluding one factor and then tying that particular factor with the data. So individual statistical tests and significance results will give us the particular pinpoint the reason that this is it. This is how they have pinpointed air pollution with mental health also.
If suppose the AQI is 100 is safe and it goes to, then how many patients will come?
So that can vary also, because maybe the patient was not living there. Maybe I stay in a particular city where the AQI has gone up, but maybe I had moved out of the city for 3 months. So that's AQI was not affecting me. So just to know, so exposure factor is the duration of stay. So a lot of statistical tests we do into it. Some regressions we go into it, and some regressions, multiple linear regressions we do, and then we logistic regressions, and then we find out is it for that. Then we had, sir, as Dipankar Shah sir was saying, Dr. Professor Arun Sharma sir, we were doing one study where we had this continuous air quality monitoring of area. So there was this machine, we put it there, and there was this machine which was continuously recording 24/7. It's like a halter machine. Continuous air quality monitoring, indoor air movements, it was monitoring. And then with that, we will see if any change is there or not. So that will, pinpoint. This is the reason. In front of the house, you can install, in front of a office, you can install, and then you can see the changes.
We are doing. Can you take some study for us that we install some equipment in the house and we study the change in health of the occupants?
Yeah, sure, sir. That machine, that vision is there also. That will be very good, sir. I'll talk to sir, and finally, yes, sir. It will be very good.
That everybody talks about the effects of the pollutant. Pollution is bad or something.
But how
we-
to pinpoint?
Example that pollution is affecting in this way.
So the indoor air, the internal environment, no, it can be monitored. And with that, we can see if there's any change. Maybe for 3 months if we do, and then we see if any change is there. So we can say that the internal environment has deteriorated.
Actually, Chairman sir has rightly there. We really hardly look into the issue of impact. This strategy, the rule, the regulation are being formulated to prevent and protect the human life and particularly public health. But how much the public health is being protected by this law is never
Yes.
been this is the lacuna in our studies also and
Even for
research
smaller
also.
scale also, if
Yes.
you can do something, then it will be.
Madam,
Yeah,
one
yeah,
of
sure,
our,
sure.
Madam, one of our participant has,
One colleague,
or rather is a colleague.
Papu,
Yes.
you can join directly and talk to madam, talk to
You can ask,
Papu.
or
Good morning,
Yes.
sir.
Uh,
Am I audible?
Yes.
Yes, actually, I wish to be there, but I was little late. That's why I joined online only. Madam, I have one question. Rather, I would like to understand one thing that some researchers have linked the air pollution with increased rate of anemia. Particularly, if we talk about the Bihar, it has been increased from 57% to 63%.
Yes.
Just I want to understand that how air pollution is linked with the anemia. Just one curiosity, ma'am.
I have not gone. We have also seen few articles. We have, when you have one particular disease condition, you take many factors into account. So it is not only air pollution which is linked to anemia. Maybe many other factors along with air pollution which is linked to anemia. You have fatigue. You don't feel like eating, and so again it gets into that vicious cycle. Gastrointestinal symptoms also show up when you have air pollution, so with you. So but again implicating into particularly to that particular reason, maybe you don't feel like eating, and so but it cannot that or I have not, it will be good to see in the article.
Yes, Papu, I know the study who has carried out this study, and it was from IIT Delhi only. And whenever the article came in front of me, immediately I reacted. The anemia is related with the food. Whenever it is a food is there, how it comes, can anemia can cause? Because anemia, it is the hemoglobin less hemoglobin blood. So, and it will come from the through gastrointestinal system. And how it can be correlated with the air pollution is not understood. Then he replied to me, food is the first cause, air pollution is the third cause. But the thing, the way he has presented statistically, that the air pollution is the root cause. That was the situation happened. So this is
Since
one.
then, sir, since then I am searching answer for this question, sir. That is why I asked, madam.
Yes.
Sharad ji,
Good morning, everyone. I'm a teacher in Delhi Public School, Patna, and I was observing the discussion of the scientist and the chairman person. I have a question that is also related to a public policy. So I have an observation that when you're talking about the indoor air purifier, I think there is a concept of public good. A public good, there was once a concept of public good, that safe drinking water is a public good and it has to be accessible to everyone. But as soon as this whole concept of filter and RO came into fore, some of the people who mattered most in the policy making, they had the accessibility of this filter water, and therefore the whole campaign of safe drinking water has gone for a toss. Again, I can see the same thing happening in the air pollution as well. When we are talking about the air purifiers, which is accessible to a small unit of people, a small group of people who matter most in the larger policy of public good in making a fair what is clean air or clean water. So do you think that when you are introducing such technology, and those technologies are not equitably accessible to mainly like a state like Bihar, which has the highest air pollution, one of the highest air pollution, will those initiative will do wonders to a larger public good, or will it actually somehow derail the whole process of a public campaign and against it? How do you see this as a member of BSPCB?
So I would like to react on this. In fact, there are like air conditioning. Everybody cannot afford the air conditioning. Like the air purifier. It is certainly everybody needs air, and the state should aspire for cleaner air, what we have at present now. But certainly in some of the areas, like some patient who is severely affected by some disease, then they need air purifier because for the time being. But air purifier for all the masses, it doesn't seem practical. Now, not that anybody can afford it, and now that it is because it is a high energy consumption instrument. So you need a lot of energy, and again the carbon footprint also. So for the whole for the environment, it is not useful, or we should not encourage this. But for the people who are suffering from some disease, some respiratory problem, for their we must have such type of instrument that can be helpful.
Thank you so much, sir. I have raised this question because our school is actually working on the green school concepts, and we have been a part of this organization for long. You know, I must give you an observation as a teacher that the students at this present moment are very critical. They want answers when you do a campaign. When you do a campaign of no plastic, they'll ask you that what is the alternative that you are giving us now. And if it is just mere a campaign of poster making and of sorts, then I think you cannot raise the kind of excitement and the case of awareness in this young blood, this young generation, because if you don't provide them the answers, I think they'll just stay away from such campaigns. So one of the things that we actually look into is that if a lot of stakeholders across Bihar can help teachers and the schools to actually give those answers properly to the students, then that would be a very good idea, I'm telling you.
We really appreciate the
Yes.
feelings
Yes.
of our young generation.
We should
And
be.
if it is there, what I feel, when I personally, that our involvement is in safe hands. So this
Thank you
shows
for
real
joining.
interest.
Thank you for joining.
So may I request our online participants who have joined us online, please,
Raise your hands.
no, please just in your chat box, give your contact details, name and contact details for our records. So that will help us a lot in reaching you in our further endeavor. So now I would request Chairman Sir just to announce the next lecture in the series.
The next lecture in this series is by Dr. Nishi Srivastava, Department of Physics, Birla Institute of Technology, Mesra Ranchi. And the topic is an artificial neutral network approach in assessment of particulate matter in Eastern India region. So next lecture will be on July 27th, 30.
At 10 a.m.
Thank you, sir. So I would request all the participants to block your dates and time for 27th of July.
And so also put on your camera so that we can have a good photograph.
Yes.